There's a new treatment that claims to rid wrinkles, tighten skin, and improve overall complexion without even having the treatment touch your skin. Dermatologist Dr. Jason Emer and his patient Cassandra are back in the procedure room to show us how this works. But first, Cassandra, why do you want to have this treatment done in the first place?
As a mom of 3, I'm always looking for something to help minimize the wrinkles under my eyes for lack of sleep, and I really don't have a lot of downtime. So this is a perfect option for me, and I can't wait to see the results.
And Dr. Emer, welcome back. Jason, how are you?
I'm great, thanks for having me.
So you brought a new toy, huh?
Always have the newest things, innovative and different.
Tell us about that.
Well, this is called the plasma pen. It uses energy that interacts with the air above the skin. You could see the needle here. It doesn't even touch the skin. It delivers energy onto the skin, creates little wounds that build collagen and tighten the skin almost instantly.
Really?
Wow.
Yeah, I'm going to show you
going?
guys. So look, we use this pen. We don't even touch the skin, and little dots, little teeny channels form right on the surface. How does it feel?
Fine.
Do you have to numb the area at all prior to starting?
Yeah, we actually numbed her for about 30 minutes before. You might feel a little baby shock, but nothing big. And we're combining this a lot with other radiofrequency treatments, other energy treatments to tighten skin with minimal downtime, especially for women like her that have kids that are on the go. Those treatments are really giving great improvements in wrinkles and complexion, combining microneedles that actually do puncture the skin, like a Morpheus treatment, or a radiofrequency treatment like a True Sculpt. This combines now with those others to give a really nice improvement.
Would you ever put PRP on top of that?
You can do all the growth factors and stem cell products, PRP where we draw from your own blood. It helps it heal so much more quickly. But the great thing about this, I'm literally not even puncturing the skin. All the other technologies we have do go through the skin to deliver energy under that tightens it, like a Morpheus treatment that uses needles. I think that's great, but this has even less downtime and can be combined with that to get even more. And each of these little dots will form a channel that will build collagen and tighten the skin. And her biggest concern was her under eye.
Okay, such a common area that people want treated. So Dr. Emer, any risks to the technology?
You know, all these new energy devices have risks of scarring, bumps in those areas, and pigmentation. But that's why you really need to go to an expert and make sure you do the proper skincare and pre-prep on the skin, and making sure that it's just done conservatively. As you guys can see, it's hard to tell probably up close. If I pull down, you might be able to see there's little spaces in between all these dots. As long as you do those little spaces, it'll heal perfectly.
We'll let you finish up back there, Dr. Emer, and we will check out the results a little later. Let's see how she looks now. How do you feel?
I feel a little red right now, a little hot under the eyes, but I'm very excited to see the results in about 5 to 7 days.
Hurt at all while?
No.
So no pain, no burning,
Nope. Just a little
red.
tingly and red, like a little sunburn under my eyes.
And how long will she have those dots on her face?
So little dots can go from about 3 days to 7 days, depending on how long we're on the skin. For her, she has a little bit more of the bags, a little more wrinkles when she smiles, so we went a little stronger, probably about 7 days. But the great thing about this compared to lasers and other treatments that we do is there's not a lot of downtime to it. There's not a lot of inflammation that goes around the dots. So tomorrow she'll have a little focal little dots there, but no swelling or redness around there. Whereas with laser, there's so much heat that's delivered in the skin. You wake up with swollen eyes, and you're like that for a week. With her, she can literally go tomorrow and cover it with makeup. It's very easy.
And I think consumers want to know how long will the results last, especially comparing it to the other things we do around the lower eyelid, perhaps Botox fillers.
You're building collagen from this for 3 to 6 months at least. If you do this in a series of treatments and you continue doing it, it's just going to keep getting tighter.
How much does it cost?
It can range from $500 to $1,000 an area per treatment.
And how much is the facility fee?
0 facility fee.
Well, Cassandra, we hope, obviously, over the next few days, as the dots disappear, you're happy with your results. Thank you for being here. And Dr. Emer, thank you for sharing. So we will be following another patient who's trying this procedure on thedoctorstv.com as a web exclusive.